ask you to understand better. Education, training, and other strategy. In this slide, I also provide some of the information reference related to health literacy. Health literacy, there are many sources. Different experts, they're grading, they're explaining and defining or have some component of health literacy. It's not the same. The example that I teach you, only component of health literacy for in the healthcare organization. But there are many other health literacy, like health literacy for health promotion, health literacy in school, and so on. So I give you these slides with the references, and I have another, I think, 3 PDF articles to read health literacy from different case studies. I'll put a folder in this computer. Now we have Ajahn Sawat. Ajahn Sawat will come to talk to you and give you some example with the health literacy also. Please welcome Ajahn Sawat.
Hi, good almost afternoon, everyone. So I'll be presenting to you something that is related to what Ajahn Supat has already mentioned to you about health literacy, but my perspective is related more to the perspective of healthcare practitioners rather than patients. So I think this is really important for you to understand this another aspect of health literacy that will be very important for you as a healthcare practitioner in the future when you are trying to formulate the healthy public policy, because as a public health practitioner, you need to understand a lot of the information in the research world, because that's really important for you to take into consideration when you're trying to formulate something related to healthy public policy as well. So presenting to you something that is challenging the status quo, something that is different from what you have heard before, something that runs against the well-established recommendations of one of the most highly renowned institutions in the world, and that is the American Heart Association, that recommends people to consume less than 7% of saturated fat in order for them to be healthy. But sometimes what the research says is really contradictory to what the American Heart Association is trying to recommend to people. So this is another way as a healthcare practitioner, public health practitioner, that we must use our own discretion in order to understand what really makes sense in this world and what is really influenced surreptitiously by people who don't mean well to the research world. So what I will be presenting to you right now is in the world of research that is related to diet-heart hypothesis, because the American Heart Association recommendations is formulated along the line of the diet-heart hypothesis. And this hypothesis says that if you consume much saturated fat, you will have much saturated fat in your blood, and that is going to clog your artery. Is this hypothesis true? The research has been divided into 2 parts. The one that is promoting this diet-heart hypothesis, the other one is going against this hypothesis. I'm presenting to you rather on the side of against the American Heart Association, so that you will be opening your new perspective. This research is the serum total cholesterol levels and all-cause mortality in a home-dwelling elderly population. It is a 6-year follow-up cohort observational study that follows a group of elderly people aged more than 75 years in one country, I think it's Finland, for 6 years in order to see the relationship between their serum total cholesterol and the risk of death from all-cause. It's called all-cause mortality. So what they have been able to find so far is that they have divided the elderly people into 3 groups. You can see that the groups that are on the low level right here of the serum cholesterol, that is less than 5 millimolar per liter, and that is equal to 193 milligram per deciliter. They have the lowest level of cumulative survival, which means they have the highest risk of death from all-cause, as compared to the elderly people who have their serum total cholesterol in between, and that is 5 to 5.9 millimolar per liter. They have something. They have more cumulative survival than the one that has the lowest total cholesterol. And you can see that the one on the top, the serum total cholesterol is more than 6 millimolar per liter, but they have the highest cumulative survival, which means they have the lowest rate of death from all-cause. So this tells you something that is quite against of what the American Heart Association tells you. This is just to see, just to show you that normally, biologically, when the amount of total cholesterol in our blood raises from puberty until the age of 45 to 50, right here for both men and women. But for women, it tends to stay a little higher than men as they go through the ages from 50 to 80 years of age. So does this mean that women are more healthy than men because of this? Maybe it's part of the reason why women live longer than men. And you can see this research is published in the BMJ, one of the most renowned journals in the world about nutrition and health. It says the saturated fat does not clog the arteries. Coronary heart disease is a chronic inflammatory condition, and the risk of which can be effectively reduced from healthy lifestyle intervention. So it points to the fact that coronary heart disease is actually caused by something that is related to the inflammation in the arteries that may be caused by so many factors such as stress, smoking, unhealthy lifestyles, and also the consumption of oils or other food products that are not cooked properly. So there has been a debate between whether or not if we're going to be using the saturated fat for our cooking or versus using unsaturated fat, which one is safer. This research tends to point to the likelihood of using oils that is high in the degree of saturation that is safer than using the oils that is high in the unsaturation degree. As you can see here, it says it is instructive to note that in an angiographic study of postmenopausal women with coronary heart disease, greater intake of saturated fat was associated with less progression of atherosclerosis, whereas carbohydrate and polyunsaturated fat intake were associated with greater progression. So if you consume much carbohydrate and polyunsaturated fat, it's associated more with greater progression in the coronary heart disease. But what is polyunsaturated fatty acids? Do you know that? It's the type of fats that contains more than 2 double bonds between carbon atoms, more than two double bonds between carbon atoms. So the higher the number of double bonds, the higher the degree of unsaturation. Whereas the oils that is saturated fat, it doesn't contain, or it contains the least amount of double bonds between the carbon atoms, such as coconut oil or lard or butter. So it says that the polyunsaturated is actually one thing that we should be taking an interest into. So this research is the reanalysis of the unpublished data from the Sydney Diet Heart Study and the Minnesota Coronary Experiment. It reveals that replacing saturated fat with linoleic acid, the linoleic acid is one example of polyunsaturated fatty acid, and one example of this type of oil is corn oil. So in this study right here, there is a comparison. It's a randomized controlled trial study, and they compare between two groups of people. The diet group received the usual diet, but it contains a lot of corn oil. But the other group, that is the control group, they received saturated fat in place of the corn oil or polyunsaturated fatty acid. And you can see that the main outcome here is that the intervention group had significant reduction in serum cholesterol, meaning that if you consume corn oil, you will have lower level of serum cholesterol. But the lower the serum cholesterol you have, the higher the risk of death. As it is shown right here, for both people whose age is less than 65 and more than 65, you can see that the diet group is in the blue line. The red dotted line is the control group. You can see that the diet group right here is a lot higher than the control group, but especially the effect is more pronounced when the age is more than 65 years, rather than the age that is less than 65 years. In the discussion of this research and also this speculation of some of the research who have expertise in this field, they say that cholesterol is actually not the one to blame, but it is something that we should be grateful for because it is really important and it is reducing as we age. So especially when the age is more than 65, that's when the body is really in need of cholesterol in order to produce a lot of hormones and a lot of nerve cells and brain cells. So if it is reduced by the consumption of linoleic acid oil, such as corn oil, it is effective in that part, but it is going to increase the risk of death from all causes as well. So, this reanalysis study is just another evidence just to say that sometimes we need to rethink and shift our entire paradigm in order to understand what's really happening in this world. Because, see, it's not very easy to say because even in the research realm, we have been surreptitiously and maliciously influenced by the big pharma, by the big companies in the world who produces medications to lower serum cholesterol, who produces the soybean oil, the unsaturated fat. If you notice that our ancestors 20, 30, 40 years ago, they used only lard for the cooking. But there didn't seem to be any high percentage rate of coronary heart disease or chronic disease. But then along came something that is called soybean oil or corn oil, and that is unsaturated fatty acid oil that was produced by one of the superpower countries in the world, and you know what that country is. And it has been purported or it has been suspected that it has been influenced unfairly by the companies within that countries that were trying to market their own oil and through the recommendation sent out from the American Heart Association. So this influence has been really malicious, and it is partly our responsibility to understand the malicious influence in this part of the research as well. So use our own discretion in reading research, in trying to dig deeper into the real answer of what is really that is, and that is causing the chronic diseases. So in the past time, 1984, Time magazine was advising against cholesterol, like eating eggs and animal fats are not very good for you, and then they were advising against this, and then they turned the table against themselves in 2014, that eating butter is actually better right now, and saturated fat and cholesterol is actually something that's beneficial, something that we should consume. So they just shift, although they shift their own entire paradigm as well. So bringing you to this part, which oils are best to cook with. So they did some experiments comparing the aldehyde content. Aldehyde is one toxic type of substance that is produced when the oil is cooked or is heated through the cooking processes such as deep frying, stir frying, pan frying. So they are comparing these various types of cooking with the various types of oil. And then, the result right here, you can see the graph here. The higher the graph, the higher the level of aldehyde produced from that particular oil. So this one, from here to here, these are the examples of unsaturated fats. Sunflower oil, the vegetable oil, corn oil, rapeseed oil, groundnut oil. They all produce a lot higher level of aldehyde as compared to the level of aldehyde produced by the saturated fatty acid oil, such as lard, butter, and goose fat right here. So it implies that actually, if we are using the saturated fatty acid oil, it's a lot safer than using unsaturated fatty acid oil. And it ranks the degree of saturation. See, the coconut oil ranks on the top. It has the highest degree of saturation, 86%, as compared to butter, and that is only 51%, 45% for lard, that's animal fat, and goose fat as well. So that's ranked on the bottom of the saturation, including polyunsaturated and mono as well, is sesame seed oil and corn oil, as shown in that previous research I talked about, and sunflower oil as well. So they are based on the result, the findings of this research. It states that we should choose the oil that is high in the degree of saturation in order for us to be safe from the number or the degree of aldehyde produced by using the oil. So the higher the saturation, the safer it is, because the lesser the amount of aldehyde to be produced. Okay? So this one again is another support using research. That is, they compare the unsaturated fatty acid oil with the saturated fatty acid oil in the deep frying of sweet potato chips right here. And the result indicates that sweet potato chips that were deep fried in a lower degree of unsaturated oils contained a lower acrylamide, that is one type of aldehyde, lower acrylamide concentration, whereas those deep fried with higher degree of unsaturated oils, such as rapeseed oil, sunflower, soybean, corn oil, right, contained a higher acrylamide concentration. So is another support academically through this research that if we are to be using oils that are high in the degree of saturation, and that is going to be a lot safer for us because it produces a lot lesser degree of aldehyde, which is a toxic carcinogenic agent. Okay, that's the end of it. It's 12 sharp. So if you have any questions or any comments, so I would be happy to address. But this is just another example and another presentation that is going to show you the importance of health literacy in the perspective of healthcare, public health practitioner, that we should be taking into consideration something that is related to the research realm, that is full of something conflicting, something that is going against each other. So it is our discretion. I know it's really difficult for us to know that whether or not this is maliciously and fairly influenced by the big pharma, the big companies that they were trying to market their products. So that's why they're trying to influence the highly renowned, respectful institutions such as the American Heart Association. It's very hard to make a definitive decision on that, but just to do your best, use your own discretion when you are trying to work on the formulation of the healthy public policy, because this part of the research that I have shown you is very vital for you in order to come out soundly with the healthy public policy that will benefit not only you, but the people in your country as well. Thank you for your time.
Thank you so much for just saying I was so learn from you. Okay.
Okay, thank you. I will put my slide first.